Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Ebola is really a lot of a do-it-yourself disease. People recover because your own body kills it. With supportive care, so if your own body is given hydration, doctors help you to manage your blood pressure. Under medical supervision, they can help your body, and your own immunity system kills it. So people recover because their own body has enabled them to survive the virus. And then they are immune after that. Sadly, with Ebola virus, the mortality rate is high, especially for children. Obviously, UNICEF is an organization that has a mandate to support children and meet child's rights. So it's a particular concern for us that the mortality rate is higher for children. You have a much greater chance of surviving Ebola if you receive medical supportive care. So for example, rehydration, stabilizing your blood pressure, have medical monitoring. You have a much higher chance. So not only if you go to the Ebola treatment center do you prevent those around you from becoming effective, but you're also doing yourself a favor because you're putting yourself in the best position to recover.
We have seen Ebola staying in semen for a little longer than any other, and maybe breast milk, yeah, breast milk for the females. So we keep, if a mother is breastfeeding, we keep testing the breast milk until they are clear of virus.
If they test their semen, sometimes people are free from Ebola after 6 months, but you can only tell by testing. If you don't want to test your semen, then you should wait 12 months. This is the WHO standard. So absolutely not after 90 days. That's a bit of a confusion of the information. It's 6 months with testing, 12 months without.
There's extensive compromise of the integrity of some of the small blood vessels, the capillaries, that will end up giving way, and therefore someone bleeds.
When you get Ebola, you get more and more infectious the longer that you're sick, and you're very, very infectious, unfortunately, if you die. So burials and meeting someone that's actively symptomatic, these are the 2 points. Now, we know that Ebola virus can live on surfaces, but there is very little research that shows that you can contract it that way, but that does not mean you should continue. It does not mean that you shouldn't worry about it. It probably means that the Ebola virus is very new, and so the research hasn't been conducted. But the 2 main points are meeting an infectious person and burials. On the surfaces, you just have to keep incredibly clean, both your hands and also the surfaces. Outside of the body, the virus is quite weak. It's killed by soap, hand sanitizer, chlorine, Jik, any of these products. So wash hands, clean surfaces.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.